the impart of science and technology in medical services telemedicine. In the material of present-day medical services, the brushstrokes of well-being plans portray protection care, individual strengthening, and a better society. In the tremendous scene of medical services, where distance can be an impressive hindrance, telemedicine arises as the guide of development, destroying topographical limitations and imbuing science and innovation into the actual texture of medical care conveyance. Breaking topographical shackles, the telemedicine odyssey. Envision a situation where clinical mastery isn't limited by miles or mountains. Telemedicine, with its advanced ability, breaks the boundaries of geology, carrying medical services to the fingertips of people, no matter what their area. The story of Emily, dwelling in a distant town, unfurls. Blasted with a secretive illness, Emily's admittance to medical care was restricted. Enter telemedicine. A virtual counsel associated her with an expert many miles away. The geological obstacle changed into a scaffold of network, guaranteeing convenient and precise clinical mediation. Telemedicine isn't simply a channel for video calls. It's a story of openness and inclusivity. Provincial people group, underserved populaces, and people in distant areas currently have a help to medical care. Because of the computerized spans woven by telemedicine, science and innovation as medical care partners, the advanced renaissance. The marriage of science and innovation in telemedicine isn't simply an organization, it's a progressive union. From wearable gadgets that screen imperative science continuously to man-made reasoning calculations that aid diagnostics, the medical services scene is going through a computerized renaissance. Consider the tale of James, a senior resident dealing with various persistent circumstances. With the guide of wearable gadgets, James's well-being boundaries are constantly checked, and inconsistencies trigger programmed alarms to his medical services supplier. Science and innovation aren't only receptive in this situation, they are proactive watchmen, forestalling well-being emergencies before they unfurl. Besides, telemedicine's combination with electronic well-being records, EHRs, guarantees consistent data stream, enabling medical care experts with far-reaching bits of knowledge into a patient's clinical history. The outcome isn't simply effective medical services, yet a customized and interconnected approach that puts the patient at the focal point of the medical services ensemble. The telemedicine suggestion, a dream for the upcoming medical services. As we explore the domains of telemedicine, the vision for what's to come solidifies. It's a medical services scene where distance is no obstruction, where clinical skill streams pervasively, and where science and innovation stand as sturdy partners chasing well-being and prosperity. The reprise calls, a future where telemedicine isn't simply a reaction to emergencies, however a necessary and super durable feature of medical services conveyance. In this coordinated vision, medical services turns into an agreeable ensemble, resounding with openness, development, and the steadfast obligation to engage each person with the advantages of present-day medical telemedicine patterns, a computerized unrest in medical services. In the kaleidoscope of medical services, the focal point of telemedicine keeps on advancing, refracted through the crystal of computerized change. What's in store unfurls with commitments of extraordinary openness, trend-setting innovations, and a change in outlook by the way we see and access medical care administrations. Expanded reality, AR, and augmented reality, VR, reclassifying patient commitment. As we walk into what was in store, expanded reality, AR, and computer-generated reality, VR, are ready to rethink the patient experience. Envision an existence where patients, through VR headsets, can essentially enter clinical offices, talk with trained professionals, or even take part in directed exercise-based recuperation meetings. AR overlays genuine situations with computerized data, upgrading diagnostics and medical procedure arranging. These vivid innovations are not just about accommodation. They hold the possibility to change patient commitment and treatment appreciation. 5G availability, releasing the force of high-velocity information move. The rollout of 5G innovation is an impetus for telemedicine's transformation. Fast, low idleness availability opens roads for constant distant patient checking, superior quality video meetings, and consistent transmission of clinical information. This improves the nature of telehealth administrations, as well as empowers the incorporation of information-serious innovations like computer-based intelligence and distant diagnostics. Blockchain in telemedicine, getting well-being information exchanges. The future of telemedicine is laced with the hearty security gave by blockchain innovation. Blockchain guarantees the trustworthiness and security of well-being information, crucial in a period where computerized well-being records and telehealth exchanges are omnipresent. Patients oversee their information, and medical services suppliers can safely access and update data, encouraging a reliable and straightforward medical services environment. Web of Things, IoT, reconciliation, making a well-being information ensemble. Picture a situation where wearable gadgets consistently speak with telemedicine stages, making a constant stream of well-being information. The Web of Things, IoT reconciliation, is the foundation of future telemedicine, empowering remote checking of imperative signs, drug adherence, and way-of-life factors. This interconnected snare of well-being information works with more customized and preventive consideration methodologies, prescient examination, and customized medication, fitting telehealth arrangements. The future telemedicine scene will be formed by prescient examination filled by AI calculations. These calculations, examining immense datasets, will recognize designs and anticipate well-being patterns. The outcome is a shift towards more customized telehealth intercessions, where treatment plans are custom-made to a singular special well-being profile. Upgrading results and limiting experimentation draws near. Computerized therapeutics, recommending programming for treatment. Later on, medical services experts may progressively recommend computerized therapeutics, programming intended to treat explicit ailments. These mediations, whether as applications or virtual projects, will supplement or try and substitute customary drugs for specific circumstances. The joining of computerized therapeutics into telemedicine stages makes an all-encompassing way to deal with patient consideration. As we look into the precious stone chunk of telemedicine's future affected by computerized change, the skyline is painted with development, network, and a reclassified patient encounter. The story rises above virtual councils. It imagines a medical services scene where innovation turns into an empowering influence, upgrading openness, personalization, and the general nature of care.